And with long-term care facilities like being the furthest from a rebound, we know that many are wondering where that leaves relatives really eager to put their arms around loved ones, or those who need long-term care but aren't able to move into those facilities. Our Katie Legrone is getting answers for families tonight.
They are Floridians hit hardest by COVID-19. The elderly, the vulnerable, the moms, dads, grandmothers, and grandfathers who call one of Florida's nearly 4,000 nursing or assisted living centers home.
We are still on the front lines of trying to mitigate the spread in our care centers.
So far, the virus has invaded more than 400 long-term care centers, infecting more than 2,600 residents and staff, and ultimately killing nearly 400 of them, according to cases reported to Florida's health department. Kristen Knapp is communications director for the state's healthcare association.
The virus enters a nursing home. I don't think that is a admission of you failed. This is the progression of this virus.
Still, families watch and worry.
It worries me to death.
Dana Battles is in Ohio. Her mom is a resident in a Sarasota assisted living facility and fears what's to come.
They don't have it under control yet, and I don't feel that anybody is safe.
50 days after the state locked down long-term care centers, they remain locked down. No visitors, no families, and no plans to lift restrictions anytime soon. Despite the grim picture, the industry is working to recover.
And I would just encourage anyone at home worried about what they see on TV to know that there's a different story.
Luke Newman is an executive with Palm Garden Healthcare, overseeing 14 nursing homes and assisted living facilities in the state. Several are battling COVID outbreaks. At his facilities, recovery starts with testing everyone.
Anyone and everyone that's willing to take the COVID test.
Across the state, testing has ramped up inside elder centers. So have supplies like gloves and masks. Still, more is needed before the industry can fully rebound.
The more we can expand the ability to test in our state, I think the greater we'll have, again, more information and be able to make some important decisions.
Knapp says some long-term care centers are still admitting new residents. But for families seeking care and worried about letting their own loved one inside,
if you are unable to safely care for your loved one at home, then it's really important that you have those conversations, whether it's with a home health aide or with the nursing home administrator or the assisted living, depending on the level of care your loved one needs. At the end of the day, you want to make sure that they're safely cared for.
And just as you would if COVID wasn't an issue, do your research. Ask how centers are handling positive cases. Take a look at past inspection reports, specifically if they followed infection control guidelines. We've posted a link on our website with additional resources. Katie Legrone, ABC Action News.
So here's the rebound rundown for families waiting for long-term care centers to ease restrictions. Centers remain on lockdown, but testing continues to increase. Some long-term care centers are still taking in new residents. Families interested should talk to providers, ask detailed questions about how COVID-19 cases are being handled and their history. We've put a link to this story on abcactionnews.com. Just click on the Rebound Tampa Bay.